My name is Aparna, and I am a pelvic floor physiotherapist at Cornerstone Physiotherapy. I work with both men and women who are experiencing a variety of pelvic floor issues, helping them regain their confidence and improving their optimal well-being. A lot of people think physiotherapy is just about pain, but it's really about restoring your function. So after prostate surgery, many men experience urinary leakage, but with the right guidance, it's absolutely possible to regain this control, as well as the changes in erectile function. We'll be able to work on this with patients to improve their pelvic floor muscle function, blood flow to this area, pelvic floor coordination. Erectile dysfunction is very common after prostatectomy, but with pelvic floor physiotherapy, there are many things that we can do to improve this. However, this is very different for all patients, and why someone might be experiencing this, whether it's due to increase in pelvic floor muscle tone or pelvic floor muscle weakness, or if it's due to poor coordination of those muscles. So by doing a thorough assessment, we'll be able to figure out what is contributing to their symptoms, so we're able to create a treatment plan best for that individual. Rehabilitation is all about getting your body ready before surgery, and seeing a pelvic physiotherapist prior to your surgery has definitely been a game changer for all of our patients. So during this session, we first educate patients on what their surgery will include, and we will talk about the side effects of their surgery. And oftentimes when patients come into the session, they don't always get that information from their doctors. They'll talk about their surgery, but sometimes they won't really get into the side effects that they might experience. And by us giving them that information, they often share that they feel a lot more confident prior to their surgery. So during that initial assessment, we will do an external assessment to just assess their posture, their movement patterns, and we'll also include an internal assessment as well to get an idea of their baseline pelvic floor muscle function. This includes their pelvic floor muscle tone, if their muscles are tight, or if their pelvic floor muscles are weak. So we will give them a grade from 0 to 5 to get that baseline and reassess this after their surgery as well. We'll teach them pelvic floor exercises during this time. So then once their catheter is removed after surgery, they already know what to do and when to start. We talked a lot about urinary incontinence or leakage, as well as erectile dysfunction, but there's a lot more that patients will complain about during that session, and a lot of things that we will notice as well, such as scar tissue pain, depending on the type of procedure that they've had, as well as abdominal tension, which can then impact bowel function. So during our assessment, we will not only assess their pelvic floor, but we also do a thorough assessment of their abdomen to see which areas of their abdomen might be contributing to their pain. We ask a lot about their scar tissue pain. So during our external assessment, we will assess their abdominal scar to assess the scar mobility to see how it is moving, but also to see if there's any pain reproduced with that palpation or us moving that scar. And this is something that we will be able to work on during the session, but also we will be able to provide self-management strategies on how patients are able to work on this on their own at home. It's completely normal to feel embarrassed or nervous, but at Cornerstone, we provide a safe, professional, and a judgment-free environment. And every part of that recovery is treated with respect, privacy, as well as expertise, so you are comfortable asking for help.